Wow, this looks great.
Oh, I'm so excited. Dr. Ching, thanks for joining me for breakfast.
Of course. Thanks for having me over.
Dr. Ching.
Yes.
Okay, so we just made this omelet. I think it's time for us to eat it,
I
yeah?
think so,
okay,
yeah.
I'll serve you.
Oh my goodness, thank you so much.
That's the least I could do. And Dr. Ching, do you want some avocado?
Oh yes, please. I
Yeah.
love avocado.
Healthy fat.
Absolutely.
I'm the good kind of fat, right?
Thank you.
Avocados. Oh, I want some too.
Oh, here's some berries as well.
Thank you. I've been eyeing those berries
Yes.
all morning. I cannot wait to have some. So, in this whole vein of us, you know, talking about anti-inflammatory foods and just living an anti-inflammatory lifestyle, what are some things you feel like are important, especially for our seniors to learn, right? Like, I know for me, I try to, you know, I have some underlying health conditions. I really do try to live an anti-inflammatory lifestyle with sleep, with eating, but what other things can you think of that could really benefit our seniors just getting rid of their inflammation?
And by, you know, with you referring to anti-inflammatory, you know, there are medical conditions that result in increased inflammatory state, you know, when you're ill, sick with infection, or unfortunately for some folks, they have, you know, some autoimmune conditions that might increase inflammation in the body. But if we were to think about everyday kind of day-to-day living, kind of trying to aim for living a healthy, balanced life with anti-inflammatory kind of lifestyle is very important as well.
So you mentioned something. You said that there are some medical conditions that are more inflammatory. And I know you see our senior patients all day. So what are some inflammatory conditions that you come across on your day-to-day?
Absolutely. So by inflammatory conditions, I'm referring to like things such as diabetes or high cholesterol, high blood pressure. Those things can really result in an increased like plaque buildup within your vessels. And when those occur, you can develop heart conditions like cardiovascular diseases from that. And so we really want to try to aside from like medications, we also want to delve into other aspects of day-to-day living, such as diet, activity, mental health, really try to minimize one's you know, risk factors for developing these kind of conditions.
Got it. So you see your patients, heart disease, arthritis, and so, well, yeah, what I wanted to talk about today was how to mitigate that.
Absolutely.
But first,
yeah,
you want some coffee?
Absolutely. Please let me get this for you.
Oh, thank you.
Of course, of course. This smells great, by the way.
Oh, this looks delicious, Dr. Ching.
Yes, coffee with this wonderful recipe of yours. I can't wait to try it. May I?
Yes,
I'm actually going to grab a bite, actually.
Please do. So if you have not watched our video where we taught you guys how to make this omelet, please go ahead and watch it. Basically, we walk through the step-by-step ingredient addition when we make this in our kitchen. But let's talk about the ingredients. As we're trying to get our seniors and just us in general to live a more anti-inflammatory lifestyles, there are some great superfood health foods in here. Tell us about it.
Absolutely. So, you know, in part of your recipe, we have the eggs, we have the green leafy vegetable, in this case, spinach. We have bell peppers, and we have onions and avocado as well. And those are all great in its own way in terms of having anti-inflammatory properties. And actually one of the stars of the show that we added today is a turmeric. So turmeric is actually one of those very healthy spices, including like ginger, that can provide some anti-inflammatory effects in the body.
Wonderful. I know. My grandma is a big proponent of eating turmeric every single day. She actually will go to the health food store and take it in pills as well. And I don't know, she is healthy. She moves so well. So if turmeric is the secret ingredient, I feel like we all should be doing that.
Absolutely. And it just takes a little sprinkle in your food.
Awesome. Well, aside from food, what else would you suggest our patients do to reduce their inflammation? I think we've talked before about movement and how important it is, right?
Yeah, I think one of the key parts in terms of reducing anti-inflammation is activity, whether that be like just a daily walk, about 30 minutes a day, 5 times a week, or just doing some kind of strength training, or even stretches is very important. That keeps the blood flow in the body flowing well. And that's what we really want.
Yeah, movement is so key. I know, and you said 30 minutes a day, right? That's a good, amount.
Target, yeah. 30 minutes a day.
Nice. I mean, I try to do that, but it's difficult enough for me. I don't want to go out, especially just in the state of how things are right now. Also, going to a gym can be kind of difficult sometimes with scheduling, and but something that's really cool that Rancho Family Medical does is we have our Choose Health courses. So on Choose Health, we have one course that is essentially, we partnered with CrossFit by Overload to do a functional fitness course. So we had someone actually teach our seniors how to do movements and strength training, resistance training. And it's a course that you can do every single day at home. We also have a Pilates course that we've done, again, for our seniors, making sure that they learn movement, stretching, breathing, just doing that resistance training like you talked about. In addition to, I know aerobic exercises, just walking is great too, right?
It's great. It's low impact, and it's going to help keep the heart rate up, keep the muscles active, especially as the body ages. There's going to be muscle atrophy, and if you don't use it, you kind of lose it. So to really keep it kind of conditioned is very important.
Oh gosh, that is so important.
Yeah, and aside from helping with inflammatory states, it can also help with another very common condition like arthritis. Osteoarthritis is something where we want to have folks, strengthen their muscles so that the joint-on-joint impact is minimized.
Okay, and they do that. That's what movement does, is it strengthens their muscles, strengthens their joints.
Exactly.
And that's what the food does, is makes it not as inflamed so you can move, right?
Exactly, yeah. All these foods right here is great in terms of anti-inflammatory, antioxidant properties. We want to stay away from processed foods and things of that nature. When I advise my patients what kind of foods that they should really target from day to day, I advise them, if they go to the market, to stay on the sides, because that's where you're going to get your healthy, fresh produce, fresh fruits.
That's true. If you picture a grocery store, everything on the side is always going to be whole foods. So you have your vegetables, you have, your eggs, but if you go in through the middle of the aisle, that's where you have your cereal aisles, you have your canned foods.
Exactly. Everything's processed, refined.
Interesting. I mean, there's nothing wrong with a good can of tomatoes or something like that, but I see what you mean. Just trying your best to stay on the outside of the grocery aisle. That's a great tip. I'd never heard that before.
And typically, if we want to really encourage a really healthy diet, a lot of the foods that encompass the Mediterranean diets is really something that...
I heard about that. Can you touch more on that? I heard that fish. When I think of Mediterranean diet, I think of actually being on the Mediterranean and having access to fresh fish all the time, but can you tell more about the Mediterranean diet in general?
Absolutely. The Mediterranean diet is something that is really healthy for folks to really take part in their diet. Includes more fish products than kind of red meats. And that's where you're going to get proteins, and proteins also come in the form of nuts too.
So cashews, sunflower seeds, those kinds of things.
Or nuts, and let's see, soybean-based kind of products as well. And also healthy oils like extra virgin olive oil, very good.
Which is what we use to cook in our omelet. We used extra virgin olive oil, which is so healthy for you. Again, another healthy fat, which is just so great for your body.
And also an assortment of vegetables and fruits as well.
Vegetables are key, aren't they?
They're always key. A rainbow, as we can see from this, that it's very colorful, and I always aim for a rainbow of kind of assortment of vegetables and fruits.
And I hear in the Mediterranean diet, they really do try to limit red meat. That's what I'm hearing. Is that, I think I read that somewhere. Is that red meat, is it an inflammatory?
It's an inflammatory kind of food, unfortunately. I know it tastes great.
Oh, it's so good.
Yeah.
But that's okay. Fish is delicious too.
Delicious.
Swordfish, salmon, tilapia. You got it all, you know?
Exactly, yeah. But I think in life, there's always going to be a balance. So,
okay.
Yeah, moderation and balance is key.
We talked about anti-inflammatory foods. What would be considered an inflammatory food? You said processed.
Processed
What
foods.
other things should we avoid?
I'd say like fried foods. Fried foods, unfortunately, you know, they contain a lot of unhealthy fats.
Okay. Yeah, that makes sense.
Right. A lot of things that are kind of white, simple, refined carbohydrates.
Okay, so we're talking breads, pastas. Okay, and that's not really included in the Mediterranean diet then?
No.
Okay.
If you were to eat pastas or rice, you know, more complex grains.
Whole grains?
Yeah, whole grains, quinoa, brown rice. Those would be something that they focus more on.
Awesome. Okay, so we have the anti-inflammatory foods. We have what inflammatory foods to stay away from to reduce inflammation. What about stress? I know that is stress just keeps rising year after year, I feel like, and it is so inflammatory. How can we mitigate that?
Absolutely. I think that with stress, it's very hard to really control that in your life. But I think that one way we can, you know, teach patients to how to control and kind of react to it. Okay. And you know, stress is going to be all around us all the time. Yeah. But kind of how we react to it is key.
How do you mitigate stress in your life? What are some of the practical ways that you take to ensure that you live as much of a stress-free life as possible?
Absolutely. Well, one key thing is that's very essential is sleep.
Okay.
And sleep is something that, you know, is a key part of day-to-day essential kind of living. Okay. And
Dr. Ching, why is sleep so essential? You know, I know we all feel so crummy after we don't get a good night's sleep and we are stressed, but why? Why is it that when you don't get good sleep, it ruins your whole day? Why?
Well, sleep is very important because, you know, if you think about it, we spend at least half of our lives, you know, in a resting state. And during that time, our body needs the time to recover, you know, and recover our energy. And so, you know, our mind needs to take some time off, our muscles and everything needs time to really rest and regenerate. And
that makes sense.
Yeah.
So it's like sleep kind of gives your body the margin and the energy to be able to do what it needs to during the day. So if you're not getting good sleep, of course, every little thing is going to stress you out, which then leads to a body response, right?
Exactly.
Of stress, inflammation, and
exactly. Your mind's going to be fatigued, your body's going to feel fatigued.
Right.
And you know, that's just going to be spiraling down.
Okay. It's interesting because I feel like if you did one of these things, like say you ate only an anti-inflammatory diet, but you got horrible sleep and you didn't move, I feel like that wouldn't be as effective. It's like you have to do it all together, right?
Right, exactly. It's a very fine balance. So trying to incorporate all of this is very important.
Okay, so we have our 30 minutes of movement a day with our Choose Health courses. We have eating anti-inflammatory foods. Staying away from fast foods.
Staying away from fast foods, right.
And then getting great sleep.
Getting good sleep, yeah.
Okay.
Yeah, and on top of that, one thing that I always like to recommend to my patients is to find a hobby. Because hobbies are very important to, you know, it can result in, you know, physical well-being as well as mental well-being as well. So having
That's awesome.
Yeah.
That's awesome. I love that that is advice that you give to find a hobby and pour yourself into something. What is your hobby? Or one of them?
One of my hobbies, actually, I love the outdoors. And, you know, on days like this, as you can see, you'd probably find me like hiking.
Yes.
So I just love the outdoors and that's how I stay active.
Nice. So it's kind of, you have being outside, being active, also moving so you're not having inflammatory issues. So it's like killing two birds with one stone. That's awesome. Well, what hobbies would you encourage for our seniors? If you were going to say, hey, this is a great thing to pour yourself into, what other things would you suggest?
Absolutely, especially for seniors, not only do I recommend hobbies that, you know, can result in physical, kind of physical well-being, such as like a lot of them, they like to enjoy walking, or they enjoy like golfing is a popular hobby.
Oh, nice, yeah.
Which, you know, it's very active.
Yeah, definitely.
Bowling is pretty active, and they enjoy that.
And that adds some of that resistance training with the ball, right? Okay.
Exactly. But also, I do encourage them to also partake in activities that continue to stimulate their mind, because just like your muscles, skeletal muscles, the brain is also something that you want to exercise too.
That's awesome.
Yeah, I would encourage them to have as much or partake in as much kind of group activities as possible, because that interaction is going to keep their minds, you know, sharp.
Awesome. Oh, I love that. Yeah. Thanks. That's such great advice, Dr. Ching. Well, I guess let's continue just eating and enjoying our morning.
Absolutely.
Cheers, Dr. Ching. To you.
Cheers to you as well, and to our patients.
And to our patients.